Good morning to you once again. We greet you with the beautiful Johannesburg skyline as we say welcome to Constitution Hill once again, where we're broadcasting live. We're covering issues related to men for a change. So ladies, let's support the men as well. They've been alongside us throughout the course of August, but you know that we cannot fully enjoy our rights and freedoms as women without men who are progressive and who do not feel threatened by an empowered woman. Now today, SANAC will be discussing a number of issues related to men and how they fit in, how they should be relevant in society. And one of the key issues of the roundtable today will be about men's health, healthy men in a healthy society. Joining me now to discuss this further, we're joined by Reverend Bafana Kumalo. Reverend, very good morning to you. Thank you so much for joining us.
Good morning.
When we talk about health, let's talk about the physical aspect of health. You know, there's been a taboo of old that men don't want to be seen taking pills or going to the doctor or going for checkups because it's just unmasculine. But now there must be a change. There is a tide that is coming that sees men starting to take initiative and action when it comes to their health. Tell us about your role in making sure that that happens.
Well, we know that when men don't take care of their health, it impacts on society. It impacts on women particularly because women have to take care of the men who are sick. It impacts on children. And we are saying as the men's sector, it's important that men must take care of their health because then it improves the health outcomes broadly of all of us in society. And, you know, this notion that tigers don't cry, we think doesn't work for men. It doesn't help to simply stay at home and keep quiet when you know that you have something that is affecting your health. Men who stay at home with simple ailments like prostate cancer, for instance, because they don't want to go and test, they end up, therefore, with much more serious challenges. Nelson Mandela, Archbishop Tutu, who took care of their health, prostate cancer was discovered and they were able to be healed because they were accessing treatment on time. And therefore, we're encouraging all men to really take care of their health.
And SANAC's screening of men and making sure that the men have this access to the technology that is needed in order to detect things like perhaps prostate cancer, HIV or any other infections. Talk to us about your role.
Well, as SANAC men's sector, we are focusing mainly on HIV, but we know that HIV is but one ailment that we have to deal with. When we talk, for instance, about the HCT, which is one of the aspects that we'll be talking about today, it's very important that we are not just talking about HIV, we're talking about men checking lifestyle diseases like diabetes, high blood pressure, because we know that these are challenges that men are facing every day. And therefore, it's a comprehensive approach to healthcare because we think that it makes a difference in the lives of men.
If I may go back, though, to HIV/AIDS infection, and we are seeing a large number of women, young women as well, with infection, and it has been attributed to, perhaps not scientifically, men, perhaps sugar daddies who are involved with these young girls, men with multiple partners and don't condomize and help them to spread the infection of HIV/AIDS among women in particular. How do you spread the message about men, saying that if you are going to be involved with a number of women, young girls, whatever it may be, that you do make sure that you are protected and you protect your partner?
Yeah. There's enough evidence that shows that actually intergenerational sex is part of the problems, and that's related to masculinities, what I call risky masculinities of older men who choose to have relationships with younger women. It's related to issues of poverty, people who are exploiting the fact that, you know, people don't have money, don't have food. We see a lot of older men, for instance, in the higher education institutions on Fridays picking up young girls. Now, all of those things point to what we call norms that are making this permissible, because it's expected for a man to have many women. It's expected for a man to show your manhood by the number of women that you can keep. Now, when we started this campaign a few years ago with Brothers for Life, we began on a spirit that said, yenza kahle, do the right thing. In other words, how do we as men hold each other accountable?
To do the right thing.
Yeah. For older men to target younger women particularly, because HIV statistics show us that young women from the ages of 14 to 25 are much more vulnerable, precisely because of this phenomenon.
I want to discuss that further with the Brothers for Life, and we will be having a guest from them a little bit later. My Reverend, thank you so much for having joined us. Issues of male circumcision, issues of that ever-elusive thing that we wanted to speak about, Man of the Year. We'll get to all of that and more in just a little while, but Vay, it's back to you in studio.